ಆ ಬೆಡ್ ಯಾವ ರೀತಿ ವರ್ಕ್ ಆಗುತ್ತೆ ಅನ್ನೋದನ್ನ ಅವ್ರನ್ನ ಬಾಯಲ್ಲಿ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿಸ್ತಾ ಹೋಗ್ತೀನಿ.
Hi, so we are Curious Labs. We are trying to help prevent bed sores. So bed sores is a problem very common in hospitals as well as home. So the repositioning is a difficult problem. Like every 2 hours you have to reposition. So we have come up with solutions which you can retrofit into any existing bed. We have two versions, one for the home and as well as hospital. So right now we'll show a demo of the hospital version. So this is the control unit. So in order to turn a patient, let's say, very effortlessly, let's say I am taking this. When the patient needs to be turned, let's say from zero to any angle, okay, because for various procedures in hospitals, for suctioning, for back care, for any sort of bedsheet change, you have to turn the patient, which is a labor intensive process and creates a lot of effort for the nurses. So with less effort, almost zero, let me show you how to actually turn a patient from zero to actually a lateral position. So Shafi, you can hold this. Okay. So yeah, you can hold this. So right now the patient is slightly getting turned automatically. All the nurses have to do is slightly move the patient's leg. Continuous, yeah. Adjust the patient's body. So you can now itself see that I've almost got zero effort in this. Okay, the patient is literally turned to the sideways, through which the nurse's issues is actually completely eliminated. Now I can have access to it. You can stop it. Now the patient is laterally turned to this condition. Now let me change the port. So this is the deflation port wherein I'll actually get access so that I can put this down, deflate it. Now this is automatically coming down. Okay. Now the nurses can actually do any sort of procedures. Like let's say they want to do massage on that, they can do it. They need to change the bed sheet or the dress change. So by which we are actually trying to eliminate the effort on the nurses. At the same time, the patient is getting the gold standard of care. So yeah, you can come down. So the same version we have one for home as well. It is called as Eternal Home, in which the patient will be automatically turned to 30-degree continuously without creating any burden on the caretaker's side. So that's what we are developing, like Eternal Home and Eternal Hospital. Yeah, yeah. In home and okay, sure. Okay. So in homes, we have a different unit. So this is called as Eternal Home. Okay. So all the caretakers have to do is select the patient's weight. You select this. Let's say the patient is around 60 to 80 kilo. You select this. Let's say the patient needs to be in a certain turn angle for how many duration. Let's say you select that duration. And now to which side the patient should be turned. So let's say the patient is normal, they can be turned to both left and right side. You select this, then you play it. That's it. Okay, so you have this overlay which is underneath the mattress. Okay, so actually the patient gets turned continuously along with the mattresses. Okay, the patient will be given a recommended 30-degree angle with a side support so that the patient does not slide. And this happens over a duration of 8 minutes so that the patient itself doesn't know that he or she is getting turned. So this solves a lot of problems, including the effort that is taken by the caretakers every day and night in order to actually turn the patient, which right now will be continuous. There is no literal effort that is being taken from the caretaker's side. And currently, a lot of caretakers actually lose their sleep in order to actually turn the patient, which is a very big problem both for the patients and the caretakers, which is again solved. And the effort is like completely reduced from the caretaker side, and the patients itself gain a lot of independence because they are no longer dependent upon caretaker for a lot of their turning procedures. So that's what the Eternal Home does. Yes. Yeah. Take some. You want to explain that as? Oh, okay, sure. Okay. So yeah. So that is. We understand the fact that bed sores is not just a problem in bedridden patients, but as well for a wheelchair patient. So what is recommended is the wheelchair patients have to do push-ups very frequently so that the pressure is actually relieved. But the fact that most people might not be able to do it, or the time constraints or the physical constraint they have. So what we have come up with is dynamic. So this is actually the control unit. as well as the cushion with that. So what happens is that this can actually dynamically change the pressure points. Okay, there are a lot of static wheelchair cushions out there in the market, but after some time you doesn't have any pressure relief from that. But in dynamic, as the name suggests itself, it can dynamically change your pressure points. Okay, so basically you again select your weight ranges from these. Okay, so you select the weight ranges. So let's say it's a 80 to 100 kilo patient. Then you select the seat version. Okay, then you start it. So what happens is that this has a lot of cells inside, which can actually continuously alter the pressure points inside that. Okay, and it is so there are two major things what is contributing. One is the pattern which we have designed according to the anatomy of the body, so that the pressure points continuously changes. The second thing is the algorithm, which is very specific to the design, which will effectively change the pressure points. By which we have data from validation studies that it is able to relatively distribute pressure compared to any other products that are there in the market. So this is what Dynamic does, and it will definitely help the wheelchair patients, as well as there are a lot of after COVID there are a lot of work that has been in-house, like work from home, and there are a couple of inquiries who are coming from those individuals as well who are like sitting on job for like longer hours, and they want sort of a pressure distribution happening. So this actually fits their market as well. Yeah, thank you. There are three things which actually can fit under this sensor.